I'm Dr. Haran, Mehandi Haran. I'm a pulmonary and critical care attending at Our Lady of Lourdes in Lafayette. And we started this pandemic in 2020, around March. I believe my first patient I saw with COVID was last year in April. I do not believe any of us thought that we'll still be dealing with the same. This is our fourth surge, and this is the worst I have seen ever. I have been in this field for around 10 to 12 years, and including my seniors, myself, we have never seen or lived through an endemic of this magnitude, to say. At Lourdes, we are a 26-bed ICU, out of which all 26 patients with this surge, with the current surge, are because of COVID. They're all on the ventilator. Their average ages are 30 to 50s. Just to put that in perspective, before COVID, average age of patients in ICU would be 70 to 80, and you would never have 100% patients on ventilators. So the disease has become much more severe, much more life-threatening, and I think it's affecting much more people than it was before. And I'm talking about only the patients in the ICU. On our list right now, currently, there are 70 plus patients, out of which another 25 should be in the ICU, but we just do not have the beds or the staffing. We're just short of them, and these patients are extremely critically sick. Most of these patients were fully functional before. They were regular people like you and me, working, have families, have children. And there are actually patients even in 20s in the ICU on the ventilator. So it is much younger, much more active population, and most of these patients were relatively healthy before this. So currently in the ICU, if we took a national average only of patients in the ICU, 95% of them are not vaccinated. Are there any vaccinated patients? Currently in my ICU, no. But in the last 1 month, have I had? Yes, 1 or 2. Just to add to that, there were 2 patients who had just received 1 dose, and there was another patient who, she was elderly, she had multiple risk factors, she was on dialysis, she had end-stage heart disease. So yes, vaccinated people are getting admitted to the ICU, but they're far and few. 95% of the national average, and currently in my ICU, 100% of them are not vaccinated. This is a combination of 2 questions. One common thought process was it rushed? I would say it was expedited. Now, to break that answer, it is an mRNA vaccine. There is a lot of misinformation regarding this as a new technology. It is not a new technology. It was initially released in 2004 or 2005. There have been multiple vaccines which have been made on this or tested on this scientific phenomena. None of them were mass-produced because there was never that much of a need. A pharmaceutical company is making a vaccine, a lot of them for diseases in third world countries, so they were never mass-produced because there was no reason. Now, so the technology was there since 2005. It has been extensively studied. Was the vaccine expedited? Yes, but expedited means that all the resources were put in. There was an immense level of both financial support, scientific support given by the previous government, including the Trump government, and globally, to try to expedite it because we are in a pandemic. Anytime you start studying a vaccine, you go through phase 1, the data gets reviewed, you go to phase 2, the data gets reviewed. And the reason for that slow progress is purely funds. The pharmaceutical company does not have that much funds. If I had to put it in simple terms, because of the global level of pandemic, and they were supported a lot by the government with full access so that they could do multiple things at the same time. So all the processes were done, all the testing was done, but they were able to do it simultaneously because there was a lot of scientific support for equipment, support financially, so no step was missed. Now, any vaccine, talking about the long-term side effects, do we know that does this have any long-term side effects? The honest answer is no, we do not know. Will we ever know? No, we will never know. And I would want to add to this that any vaccine which is administered, long-term side effects can only be known for medications which are given regularly. Something I took in January, that's when my second shot was. 15 years down the line, if I have a disease, there is no way you can prove or even assume that that vaccine caused it. There are multiple things in your everyday life, lifestyle, environmental exposure. It's all a combination of that. So anybody saying that a single shot caused it, do I know it causes it? The honest scientific answer is I do not, but there is no way of knowing that for any vaccine. There was actually a very good study done in Israel, which is the country with the highest percentage of vaccination, in which they took 15,000 pregnant women in second and third trimester, and they administered them the vaccine, and there were no known adverse effects, which were, I mean, yes, once you get the vaccine, you had those, you can have some fatigue or weakness for 2 days or low-grade fever. Only the documented side effects were seen. There was no increased incidence of any pregnancy-related complications. Coming to the next part about lactation on women who are nursing, in the same study, because they were the first ones who did that, was saying there is measurable antibodies in the breast milk, which the medical inference is that if at all, there'll be some protection given to the children, or I should say the infants. But yes, it is completely safe in lactating mothers. Coming to the first part, is it safe in someone who's trying to conceive? Now, just to put that in perspective, globally, there have been around between 110 to 120 million doses which has been administered. There is no increase in chances of difficulty conceiving. Whatever the percentage of infertility in the regular population is, it is exactly the same or similar in patients or population which has been vaccinated. Yes. Again, multiple reasons. One, it's a viral infection, and in patients before the vaccines were approved, since the study was actually started, they started recruiting when COVID started. Your antibodies start waning in 6 to 7 months. Now that is a cumulative antibody, that is basically your body's immune response to this. So can you have the infection again? Yes. Also, with the emergence of multiple variants, the disease has changed. So I would say yes, and I would completely follow the CDC guidelines for those, that even if you've had the COVID, once you have recovered, you're asymptomatic and you're eligible, you should get the vaccine. In the current scenario, the first surge, yes, we did see that the disease majority affected only patients who are elderly and with comorbidities. My simple answer to this would be, if you know anyone who works in a hospital or in an ICU anywhere in Louisiana or states like Florida or Texas, rather than I would just talk to them. I don't even have words to say. It is the number of young patients under the age of 50 that we have not been able to save. This is a very different disease in the way that it has changed. It is affecting much younger population in a much more severe form. So if you're young and you have no comorbidities, I think it's all the more reason. There are a lot of these patients who have in the ICU who are the sole bread earners for their family. They have small children. The disease is severe, so it does affect young patients all the time. This is the worst surge we've seen in young patients. And also to put that in perspective, that as a young person, let's say you have severe disease and you still make it, there's a high chance that you will have physical limitation all your life. You might be dependent on oxygen, you might be disabled, you might not be able to enjoy the things you would have wanted to enjoy with your family and friends and children. So if there's one big, I don't think there's any bigger myth than it does not affect young patients. It is really time to come together and just have some faith and trust in science. We are all in this together, and we need to all try together to come out of it. So get vaccinated. There is enough data. It was not rushed. This vaccine was not rushed. The side effects were completely disclosed. Until the time masses are vaccinated, continue to wear your mask, because the next step, it already has started. This is the record in the last month. This is the highest increase in cases and hospitalization in children under 18 years of age. So we don't want to go right back where we started, and really, I mean, that population under 18 is a very different population. Any mortality in any age group is sad, but that's a very different age group we're talking about. So let's try to save the youngest and ourselves and our elderly population, and try to get vaccinated as soon as possible.